I'm going to share with you the findings of 2 studies done in dogs that could dramatically extend lives and save you thousands of dollars. Did you know that changing when your dog eats and how much your dog eats could dramatically extend life and reduce disease, especially arthritis? As a small animal vet for 20 years, I've stood in the exam room countless times and had difficult conversations with owners about how much pain their animal was in, what diagnostic tests needed to be done, how much those cost, when is the time to put them to sleep. It's very difficult. The cost of treatment of chronic conditions for something like osteoarthritis can be hundreds of dollars a month. And if your pet needs a surgery, easily thousands. Short, infrequent appointments means your vet often doesn't have time to talk about topics like weight and disease prevention. Medicine in general is almost always more focused on treating diseases as they crop up with prescription medications that can be required for years. But it's almost always more rewarding to prevent a disease, prevent suffering, than to try and manage it. So now we're going to dive into the 2 studies that could dramatically affect your pet's health. Then we're going to take this info and we're going to show you how you can make some simple, easy changes to really have a big benefit. The first study I'll talk about is my absolute all-time favorite study. How do you know if someone's a nerd? They have a favorite scientific study. So first of all, the study is done in labs, which are arguably the best breed that ever lived. Let me know in the comments if you agree or if you have a different breed that you think was or is the best of all time. The study, completed in 2002, was the first to show increased lifespan and health span simply by feeding less in mammals other than rodents. This is big. So let me tell you how they did it. They took 48 lab puppies from 7 litters and they split them into 2 groups. Half of them they fed the recommended maintenance diet for a large breed dog. The other half they fed 25% less. Then they followed these dogs until they died, tracking their body condition score, the diseases that they got, the arthritis, when they were diagnosed with chronic diseases, when they required treatment. The most common chronic disease was osteoarthritis, which is a very common cause of painful joints in pets, both dogs and cats. The result was huge. The calorie-restricted dogs lived on average almost 2 years longer. 2 years in the lifespan of a large breed dog like a lab, that's big. That's maybe 700 walks on the beach. So what about disease? To use the example of arthritis, which was the most common chronic condition, at age 8, 68% of the regular fed dogs versus only 14% of the lean dogs had hip arthritis. The median age of onset was 6 years old versus 12 years old. So 6 years difference. The restricted fed dogs also had a longer time until they needed treatment for their arthritis and other chronic conditions. For arthritis, it was 10 versus 13 years. Other chronic conditions, 10 versus 12 years. To put some perspective on it, that's years of healthy life without pain, without medications. My Labrador retriever, Sophie, who grew up with my boys, was 12 years old when she passed away. And I think about how many beach walks we would have missed if she had died at 10. The next study brings us new information about feeding dogs, but it's not as clear-cut about whether we should implement these changes or not. The new research comes from the Dog Aging Project, which is a multi-year project that's ongoing. I think it lasts a few decades. It's tracking 40,000 client-owned dogs in the US, looking at feeding, age, diseases, weights, lots of other parameters. Preliminary findings are coming out. The one that I find fascinating is about the frequency of feeding. So the information is from 24,000 dogs. The dogs that were fed once a day had less disease. They had better brain function, which was equivalent to being 4 years younger. So what I mean by that is if it's an 11-year-old dog, they have a brain of a 7-year-old if they're fed once a day. They also have lower odds of having many different chronic diseases. And this is something I didn't expect. In fact, when I was practicing veterinary medicine, I recommended to people that they feed their dogs twice a day because it seemed like just once a day was too long to go without food. But when we get more information, I think we need to really look at that and see if we need to make a change. But when we think about what we know about intermittent fasting and time-restricted eating in people, it does make sense that we would see some benefits because we do have studies in people that show that intermittent fasting does have many health benefits in people. So fasting and time-restricted eating have been shown to give longer life, leaner body, and a sharper mind. In people, we can see improved metabolism, so better glucose and insulin control, better heart health, lower blood pressure, improved cardiovascular markers, and we can also see disease prevention and potentially delayed onset of many age-related diseases. So can we put a lot of weight on the evidence from the Dog Aging Project? It looks at these dogs as a snapshot in time. So it tells us what diseases or chronic conditions those dogs had at this particular time and how often they're fed. It doesn't allow us to say that the feeding causes the decrease in disease. So all the report can say is that eating once a day seems to be associated with a lowered risk of disease, especially that brain health. One point that I think is really important though is the size of the study. They looked at 24,000 dogs. That's quite a lot, and especially for any animal or pet study. Sometimes we're looking at studies that have 8 cats in it or 20 dogs. In the case of our Labradors, there's 48 dogs. Looking at the information from 24,000 dogs, I think gives us some confidence that these results could very well be valid. So as the study goes on, we will get more information and we'll be able to draw stronger conclusions. So you're probably wondering, does this change anything for my pet? And what did you say about saving me thousands? Acting on this information could save you money with food cost and veterinary bills. Pet food is a big percentage of what pet owners spend for their pets. Good quality pet food isn't cheap. So what if you could cut 25% from your food costs every month? And what if you could delay treating your pet for a chronic condition by 2 or 3 years? 2 years worth of lab testing, x-rays, prescription medications, supplements, special diets, that can add up to thousands. And it almost goes without saying that preventing disease and suffering in our pets for their welfare is valuable too, priceless. So what do we do with all this information? First, we start with what we know works. Maintaining a lean body condition. This is your foundation for pet health and longevity. So what do we mean by lean body condition? So that is basically a rough assessment of how much fat there is on your pet's body. And we evaluate that by putting our hands on them. So we want to feel the ribs behind the front legs. We want to be able to feel each individual rib easily, but not see them from across the room. It's like you want to be able to count them. If you can easily count those ribs, your pet's nice and lean. If you can't easily count them, you have to press really hard, your pet is probably overweight. Another thing we can look at is that little tummy tuck. When we look down from above, we want to see the tummy go in between the rib cage and the hips. Looking from the side, we want to see that belly go up between the rib cage and the hips. 2 tips for assessing body condition. 1, get an expert opinion. Go see your vet. They have put their hands on so many dogs and cats over the years, it's almost second nature to have a feel of those ribs and determine if your pet is lean or not. Number 2, look at a chart. There's body condition scoring charts. Hill's Pet Food has a really good one, and they also have a chart that can help you determine what your pet's ideal weight is based on that body condition score. I will link those charts in the description below. So Once you've determined your pet's body condition, you decide if your pet needs to lose weight or not. If so, if your pet is a higher body condition, talk to your vet about a weight loss plan. It can be a bit complicated depending on your pet's individual needs. But in general, decrease calories and re-weigh, feel the body condition, reevaluate about every 2 to 4 weeks. If there isn't sufficient weight loss by changing the amount of calories, then decrease a bit more. Then monitor, make adjustments based on whether there's weight loss or not. No weight loss, decrease calories by another 10%. Keep monitoring, keep rechecking the weight and the body condition score and making adjustments. It takes a while, you need patience. Don't give up if there's no big changes in a month. It can take months. Once you've established that foundation of proper weight, then you can consider once-a-day feeding. But talk to your vet first and make a careful consideration. Not all dogs or cats are candidates for this. You want it to be a healthy dog or cat, not a growing puppy, a growing adolescent, not pregnant dog, nursing, or ones that have diabetes. Those animals should not be fed just once a day. If you do decide to make that change, do a gradual change. Monitor for weight, energy level, and body condition. And what about cats and once-a-day feeding? There are only a couple of studies that are done on cat fasting or time-restricted eating. They do show a benefit. There's actually one study that showed that cats that were fed once a day seemed to have higher satiety markers, meaning they felt more full when they were fed only once a day. But the science is evolving. We don't really know very much about fasting in cats. One thing we do know for sure, lean cats do much better, live longer, less arthritis, less disease, just like dogs. The science of feeding frequency is still evolving, but when combined with proper weight management, it might provide that extra edge to increase your pet's longevity and health. For more science-based tips straight to your inbox, sign up for the newsletter. Link below. Do you want to find out which pet has a better chance of helping you live longer, a dog or a cat? If so, check out this video next.